Mr. Carter with us. There you are. The gentleman from Georgia, Mr. Carter, for your 5 minutes of question.
Thank you, Madam Chair, and thank all of the witnesses for being here. We appreciate your participation. Full disclosure, I'm a pharmacist by profession, and as a healthcare professional, I know that accessibility and affordability in healthcare are extremely important to our country. If we're going to talk about public health, we have to make sure that patients continue to have access to pharmacies. You know, pharmacists are the most accessible healthcare professionals in America. 95% of all Americans live within 5 miles of a pharmacy. And that's extremely important to make sure that we have accessibility to healthcare professionals. That's why I was happy and pleased to introduce HR 7213, the Equitable Community Access to Pharmacist Services Act, a bipartisan piece of legislation introduced in our committee. And I look forward to making sure that this legislation gets a hearing and that it gets passed, because it will continue to give us access to pharmacies, and that's very important. And I'm looking forward, as I say, to working with this committee to try to do that. Mr. Shannon, I want to ask you, first of all, it was revealed in April that recently disclosed documents that the Wuhan Institute of Virology had an agreement with the University of Texas's medical branch's Galveston National Laboratory to collaborate on scientific research with the Chinese lab, and that it entitled the Chinese to ask the Texas lab to destroy any secret files. It also, in addition to that, EgoHealth disclosed to the NIH that the NIH-funded research files under their grant were in the custody of the Wuhan lab, and that EgoHealth would need to get permission from the Wuhan lab in order to turn over the records to the NIH. Again, this is EgoHealth, who got a grant from NIH. NIH wants some information, and now EgoHealth tells them they got to get permission from Wuhan in order to get that information. Mr. Shannon, my question for you is, are you concerned about these side agreements between the NIH grantees, that is, those who are getting money from the NIH, the National Institutes of Health, a federally funded program? Are you concerned about those side agreements between them and the Chinese research partners that preclude the NIH from getting access to NIH-funded data?
Yes, that's in conflict with the regulation, the grants policy statement that requires that those records be available if they're considered pertinent to the grant. And so if there's a nexus between the grant funding that the one entity received and they subaward something out of that, then that requirement extends. So yes, I would be very concerned with that. But it does go to the whole question of persons accepting risk at a level beyond their authorities or unbeknownst to their organization, and not being able to account for those things. So that's part of the broader issue of these agreements, not only between organizations, but individuals as well.
Do you think there are any national security concerns with an agreement like this? And if there are, how can that be addressed?
Well, I think when you're talking about research that's funded for critical infrastructure technologies, that certainly falls into the realm of a national security concern. The compliance aspect of this is absolutely something that needs to be addressed to ensure that there's compliance. And as I've said, the rules have been there for a long time, and NIH is not incorrect when they say nothing has changed, the rules have been there, although they put out clarifying guidance to those rules, which is important to make sure it's clear. But and you've got great people doing great things trying to get after this, but what gets checked gets done. And if it's not checked, it's not getting done. So periodic audits, periodic reviews, some type of stewardship score perhaps as consideration for an award, not to disrupt what science is awarded, but to perhaps result in additional conditions on award would be helpful.
Right. Well, let me ask you this. Shouldn't an NIH grantee, that is someone who has gotten a grant from the NIH, of course, being federally funded by taxpayers' money, shouldn't they be publicly accountable, especially to a congressional inquiry?
Well, I think they are accountable through their awarding agency. I think it would be difficult to have direct accountability for reporting from the vast number of awardees and then being cognizant also of Congress's previous priorities of reducing burden on the grantee. I think the appropriate mechanism is through the awarding agency, and that awarding agency being clear on what Congress wants to know and making sure they get.
The gentleman's time has expired. The chair is pleased to recognize, if she's available, Congresswoman Craig of Minnesota.